for joining us for Healthline 3. I'm Wendy Redman. When an emergency happens, where do you go? The emergency room or urgent care? Today we're going to answer that question for you. So with us now we have Dr. Paul Bracey with Urgent Care of Louisiana. He's going to be answering all of your questions about urgent care for the next half hour. We really want to encourage you to ask all the questions on your mind. If you're online, just fill out the information on your screen and submit it. Or, as always, you can give us a phone call. We love that too. The number to call is 318-219-4569. We'll be taking all of your questions until 12:30. All right, doctor, to get us started, let's talk about the difference between urgent care and the emergency room, because there is a big difference, right?
I mean, there is a big difference. I mean, there are some similarities as far as unscheduled visits for acute problems, but for urgent care, it is more about providing that care that falls between what the ER needs to provide and what the primary care physician needs to provide. So we kind of fit that niche, so to speak, that patient need. And those things are you know, can run a wide variety of issues, but if it's something, I frequently tell my patients, if it's something that you would be admitted to the hospital for, then that's not something that needs to be handled in the urgent care setting. You know, typically that's something that's going to need to be seen by the emergency department to more efficiently arrange an admission to the hospital if it's needed. So other things that tend to fall in the outpatient arena, such as you know, common infections, suturing, what we call closed fractures, not what a lot of people can refer to as compound fractures. Abscess or skin infection, kind of treatment that needs a minor surgical procedure done to it, such as lancing and abscess. Those things are all done in an urgent care setting, and at our clinic. And there is some variability from place to place as to what they will provide based on the types of physicians that work in that clinic. For us, we have emergency physicians, myself and another physician. We're board certified in emergency medicine and fellows of the American College of Emergency Physicians, and have had over a decade each of experience in teaching emergency medicine and practicing emergency medicine. So we've, you know, feel very comfortable handling those things in the clinic without referring to the ER. So if some places may not feel comfortable doing laceration repairs or, you know, suturing, stitches, fixing kind of or temper splinting broken bones, we handle all that in-house, as well as IV fluid hydration and things along those lines. So we do try to keep a very wide variety of options open to help patients as best we can.
Okay, well, we've got a caller on the line with a question for you, doctor. We have Alva on the line. Alva, what's your question?
Why is it that when I go to one of these urgent care places, they don't want to treat me because I'm a diabetic?
I can't speak for, or first of all, hi Alva, I'm sorry, but I can't speak for the other ones, but we frequently treat diabetics in our clinic. That's not a problem at all.
Well, I've had that happen several times, and I just wondered if there's a policy or something, you know.
Well, there may be particular policies with that particular clinic or clinic system, but there's no overriding policy that's established to say that diabetics can't be treated in the urgent care setting.
Okay, thank you.
Yeah, we do that a lot. You're welcome.
I appreciate it.
Well, thank you for your call.
All right, thank you very much, Alva. If you have a question for Dr. Bracey, give us a call, 219-4569. We're talking about urgent care today, really urgent care versus the emergency room, because you were explaining to me a little bit earlier that a lot of people get a little confused as to when it's appropriate to go to each one.
Well, right, and understandably so, because there is no, I guess, public education push to kind of talk about these issues. What requires emergency care, what requires urgent care, and there are a lot of other factors that play into it as well, as far as the timing of the the injury or the illness, your work life and work schedule. So there's a lot of things that go into play, not just, what some people may deem appropriate and others not, but typically, referring to insurance companies and how they like to approve or not approve emergency department visits. But but so there are a lot of things that fall into play in that decision for each individual person. For our clinic, we have extended hours. We're open before schools start in the morning, and we're usually from 7 o'clock in the morning till 7 o'clock at night. On weekdays, we have you have weekend hours. So that is one thing that kind of sets urgent care apart from other types of walk-in clinic settings, where you're available in many what would be considered off hours. So it makes it more convenient for the patient, but I mean, not just a matter of convenience, but a matter of ability. Because if you work from 8 to 5, it's very hard to take an unscheduled leave for whatever, or have that school note ready for your child, or things along those lines. So
plus, you can't control when emergencies happen.
Exactly. You sure can't. I mean, that's the whole definition of urgency and emergency. So we want to be there for that, and most urgent care centers are. So typically, an urgent care center is essentially defined by a location with extended hours, weekend hours, that takes walk-in patients. They may or may not have some scheduling component to their patient visits. When we get busy, we institute kind of a callback system, to kind of, so you don't have to sit in the waiting room for too long. Our strive is always to get you seen quickly and get you taken care of quickly, so you can get on with your life quickly, because nobody wants to sit there in that waiting room. And in an emergency department, rightly so, patients are triaged, and so, which means to sort. And so the sicker you are, the quicker you'll be seen. And so those patients that may have a broken toe, or a cut that's not bleeding, or have a mild, maybe even moderate infection, they may not be bumped to the front of the line, because ambulances may be coming in. Other people who are having other symptoms that may be more indicative of an a real emergent process that needs to be seen within the next, say, 15 minutes, may be coming in. And so, there's an order that's applied in the emergency department that takes the sickest patients first. And so you don't really know how long you'll be there. You really can't tell.
But you do know that if you have a major problem, you'll be seen pretty much right away, as fast as the doctors can see you.
Absolutely. And emergency departments excel at that, for the most part, in this country. So as an emergency physician, we all emergency physicians do their very best to get that done. And most, all the hospital systems where I've worked have had a focus on that as well. So, but in urgent care, it is more of a sort of typically a first come, first serve kind of a
put your name on the
alignment.
list. Yep.
Yeah, you come in and you check in. You can even check in online, so you don't have to check in when you get there.
Oh, that's convenient.
So we have links on our webpage where you can check in online. For us, if you've been a patient at our clinic before, you pretty much just walk in and tell us who you are, and you're in the computer system, and there is not much of a check-in process, so to speak. But for new patients, we have that available. So you can go to our website, and our website also links all these Healthline 3 segments.
Okay.
So if there's any questions that can be that may be answered by me or Dr. Walcott, kind of speaking at this venue, but you can see those. Also, our Facebook page, we do communicate with patients general information, not usually medically specific information, because that's kind of dangerous to do, in my mind, online without really talking to somebody and meeting them and doing an evaluation.
Proper evaluation.
But general questions, we answer through our Facebook page as well, and kind of try to post informational things out there for patients too. So, so we try to help people realize when is urgent care a good choice for them, when is emergency department care a better decision to make. But like we said at the end of the news segment, I mean, we have patients that we have seen in our clinic that we've forwarded to the hospital, when they need to, and try to streamline things as much as we can for them.
Yeah, so you said urgent care is kind of in the middle between a doctor's appointment. So say you have the flu, what's appropriate for you then at that point? Well,
we see the flu every year. Urgent care is ideal to handle things like the flu, any illness that pops up like that. The evaluation for the flu is done in the clinic, and the treatment is usually initiated in the clinic and continued beyond there. So flu, cough, cold, pneumonia, bronchitis, sinus infections, ear infections, urinary infections, you name it, we really take care of it. And another thing that most urgent care clinics will have is an in-house x-ray, the ability to shoot x-rays if needed, either searching for the pneumonia or looking for that broken bone or what have you. As well as in-house labs, and not just some point of care labs, but also some other, which are the nasal swabs and the throat swabs, strep swabs, but also, chemistry, your sodium, potassium, things like that, kidney function. And also have agreements with reference labs so that we can, if something's more complex than that, we can test for it and send those labs off. So we kind of fill that void between calling your primary care physician to get an appointment to talk about your blood pressure or your cholesterol or those things that the primary care physicians do very well, and the emergent, the heart attack, the stroke, things along those lines that need to be handled in the emergency department. We fit that middle ground.
Okay, you've got another caller on the line. This time we have Antoinette. What's your question? You there, Antoinette?
Yes, ma'am.
What's your question? You're on the air. Antoinette, do you have a question? Can you hear me?
Yes, ma'am.
Yep, go ahead with your question.
Okay. I was just wondering what type of emergencies do you do? Like, do you do kidney stones or anything like that? Because my grandson and my son's always having kidney stones. Do y'all do anything like that? Or would that be considered to go to an emergency room or to a hospital?
Well, thanks for calling, Antoinette. We do treat kidney stones in the clinic. We are fortunate to have an arrangement with a couple of different groups here in town. One where we can get ultrasounds pretty quickly if we need to evaluate for obstruction of the stone. Also, we have an agreement with one of the hospitals where we can get CT, CAT scans done pretty rapidly, usually in the same day. And then we can do IVs, so we can do the IV fluids that generally accompany the treatment of kidney stones, but don't have to. The analgesics, things to kind of relax that ureter, that tube that connects the kidney to the bladder. So yes, ma'am, we have had kidney stone patients in our clinic, and are happy to help.
Cost less, it was cost efficient, and I know we went one time to a first care and they charged them a lot of money they did an IV, and I don't know what all they didn't do, but it cost a lot of money, so I thought maybe we would check on it if anything like that happened again.
Well, thank you. I mean, urgent care usually is more cost efficient than going to the emergency room.
Okay.
And a lot of that has to depend, if you have health insurance, a lot of it depends on your health insurance company. The physicians don't have any power over that. But most hospitals and a lot of hospital-based urgent care clinics will charge two separate fees. They'll charge a professional fee for the physician, but they'll charge a facility fee for the facility. Privately owned institutions like ours don't do that. So you only receive the professional component to that, and that usually makes a big difference.
Okay, well, is there a number I can call in case we have that happen and to find out if they would take care of it?
Yeah, sure. Our clinic phone number is 868-2273, or 868-CARE, C-A-R-E.
868, what now?
2273.
2273.
Yes, ma'am. And we have a website, and I don't know if you're on Facebook or if your family members are on Facebook, but we're on there as well. So that all of that information and our address, we're on Fern Avenue.
Okay,
so
KDBS had given me a number, 681-4223, and I was recording, so I thought, well, I'd better call and see what number I could call.
It's 861.
2273.
Yeah.
Thank you so much.
Oh, you're welcome.
Okay, bye-bye.
All right, thank you, Antoinette. If you have a question about urgent care, maybe what they do at Urgent Care of Louisiana, give Dr. Bracey a call, 219-4569. We're answering all of your questions for about another 15 minutes. So while we wait on more callers, what is the biggest mistake you think that people make when it comes to deciding where to go, what to do in emergencies?
Well, I don't ever like to label a decision like that as a mistake, because that would imply that there's some knowledge that you have and that you're not applying correctly. So, I mean, I think most people do the best they can in a situation that is emotionally charged and kind of rushed. So, you know, it's never a mistake to seek care in an ER setting. If you That's what's called the prudent layperson standard. So if you have the instinct or the belief that what you're experiencing is a true emergency and that can lead to loss of life or limb within a very short period of time, I mean, there's no mistake in seeking care in an ER. I think those cases, people do a pretty good job of finding the right location to go to. So if you're having chest pains that are exertional, that have intensified, and you're sweating and you're nauseated, these symptoms that may suggest heart issue, coronary artery disease or acute coronary syndrome, then patients suffering those things tend to seek care in the emergency department, rightly so, and should every time. I mean, but it's other things where people may not even realize that urgent care is an option, such as after-hours treatment for infections, skin infections, IV hydration, stomach bugs, things along those lines, where we have the ability to treat and control the symptoms and continue treatment as an outpatient, and it's not just found in the hospital setting. So urgent care clinics tend to do very well at with those kinds of diseases. There is a Urgent Care Association of America that is really just kind of a group of people, like-minded people who kind of introduced the idea of urgent care, kind of giving some cohesiveness to the idea of urgent care, and we're a member of that group because as we move forward in urgent care, I think it's going to become even more important to kind of establish parameters of what defines good urgent care. How can patients know they're getting a quality service and have faith in that clinic and in those physicians. So we are part of that program or that national group, and there are some definitions or details that they kind of set forward as best practices of how not really medically treating people, because those best practices are established by the colleges of whatever organization is involved, such as the American College of Emergency Physicians, but more as a model of how to provide that care, so there's a kind of a process that you go through where you can become certified. And one of the issues with certification is that it requires you to be open 7 days a week. So there are many urgent care clinics that are in existence that are not certified simply because they're closed on Sundays or and that's their only reason. So, but so I think you can be rest assured that that there are urgent care clinics out there that do a very good job of providing the service that we try to do, and we're happy to fill that spot.
Okay, so during an emergency, I know it gets really hectic. Maybe you're not thinking clearly. And I mean, for a lot of us that just happens. Your just mind goes cloudy. You might leave certain things at home that you need. So what do you need to make sure that you take with you? Try to remember to take with you as you make your way to urgent care.
Well, you should always try to remember, if you're going to access the healthcare system at any venue, try to remember your identification and if you have health insurance, your insurance card, or your numbers. If nothing else, if it's during normal business hours, what insurance companies consider normal business hours, usually between 8:30 or so until about 4 or 4:30 in the afternoon, then that company can be called to get all that stuff for you, so that it's not so critical. But if it's after hours, if it's after the time that those places are open, then there's really no clearinghouse to be able to go to find that out for you. So usually your identification is a big thing. Oddly enough, physicians' offices have been charged with the task of proving that you are who you say you are, and to prevent, for good reason, to prevent medical fraud, somebody coming in pretending they're you and not having an ID to show, so medical identity theft. But so your identification and your health insurance card are really the only two things that you're gonna need, want to have with you. And if you have those things, then access at any location should be relatively straightforward.
Okay. If you don't have a regular doctor, or do you guys provide that to people as well to schedule an appointment, or is it strictly walk-in basis?
As far as offering primary care services at our clinic, we're strictly urgent care. So I tell all my patients, I don't like to oversell myself. I don't like to oversell my qualifications. I did, an internship in internal medicine, and then 3 years of residency in emergency medicine. And so emergency medicine and urgent care medicine is kind of where I specialize. So we try to help people arrange primary care follow-up. We do that on almost a daily basis, as far as somebody who has a new diagnosis of hypertension, a new diagnosis of diabetes. We will help start treatment for that patient's safety and well-being, and try to help you, guide through that maze of where to go after that. So one of the big aspects of our care is that we care, and we want to help you plug into the system. We want to help you in any way that we can kind of get where you need to be. And for those cases where a new diagnosis has emerged, a new chronic diagnosis, or there's, like I said, mentioned high blood pressure, diabetes, what have you, then we do try to forward those on to our primary care colleagues, because they do a great job. They do a great job with those, and that's their specific training. And we want to get you where we know that you're going to be taken care of the best. You know?
Okay. And speaking of which, I know it would be really helpful if everybody remembers all of the prescriptions that you're on. I know a lot of people might not necessarily know the name of it. They might say, oh yeah, I'm on a high blood pressure pill. I forget what it's called because you're in an emergency situation. Maybe your mind goes blank or something like that. So what do you recommend? Is it, should you keep a list of prescriptions in your wallet or?
That would be great. I mean, and there have been several studies that looked into medication, what we call reconciliation. So the medicines that you're on, A, do you remember the names and dosages? Or B, did that get transferred over to the person who's taken the history to find out what those are? And then C, did that get put into the chart? And is that seamless, and did that happen? So, and then as you leave, kind of that same process for any new medications. So it would be ideal if you can carry a list with not only the name, but the dosages, and the frequency with which you take it in your wallet or in your purse. If you don't, if you use a pharmacy that kind of exclusively, say you use pharmacy X all the time and they have all your prescriptions, we frequently will call the pharmacy to make sure we get an accurate list. So that's one option. As we prescribe medications, part of the, I guess, Affordable Care Act mandates the use of electronic medical records. And you have a certain time limit to do that. Well, we started with electronic medical records, so that's not a problem. But built into that also is the use of an electronic prescribing system that is a requirement. You get fined if you don't do it as a physician, but you have to pay for the service. So but nonetheless, it can serve as a reconciliation if you're going to go prescribe a new medicine. But if you went to a pharmacy that doesn't participate in that, or the system was not updated, it can't really be exclusively relied upon. So there can be some medicines on there that you're no longer taking. There can be some medicines that are absent that you do take. So we can't really rely on that system all that well. The best source of information is a note in your pocket.
All right. Anybody you can't take? I mean, are you equipped to handle itty-bitty newborn babies?
Usually, if a child is less than 2 weeks old, those still fall in the follow-up from the delivery standpoint, and there is usually a 2-week follow-up newborn check at 2 weeks. So usually we try to reserve those to the pediatricians that were involved with the delivery and the care. But we have seen kids as young as 3 weeks old in the clinic. If a child is less than 4 weeks old and they're running a fever, that workup is a very extensive workup that is probably best served at the hospital setting, or at least driven through your pediatrician's office. So, neonates are generally, they're kind of a special group, but we see children of all ages. We see adults of all ages. It's not unusual to see a 1-month-old or 2-month-old in our clinic. It's also not unusual to see, I've seen 92-year-olds in our clinic. So there really are no age limitations.
Okay. Well, we just have a couple minutes left, so I just want to say we've been talking a lot about the differences between when you go to urgent care, when you go to the hospital, the emergency room, and when you see your general doctor. So what's your advice as we leave people today? What's the main thing you want them to remember?
Well, if you have any questions about the location of services, call the facility, call the location. If that may go more, that may be easier to do through a clinic setting, through the urgent care setting, than trying to call the emergency department and find out if they treat a certain thing, because we know that emergency departments have historically served as a safety net, so we know they treat a lot of things. But call the location, Call the clinic. We're, especially for us. I mean, I can speak for us because that's,
Yeah, so give us your number one more time.
It is, I think I actually gave the wrong number earlier. It's 868-2273. I think I snuck the wrong prefix in there earlier. 868-2273 or 868-CARE, C-A-R-E.
Okay, and you can definitely call ahead and let them know that you're on your way too, and that can be very helpful, get you on that list a little faster, right?
Oh yeah,
right.
Absolutely.
Well, thank you so much for being here. I think that clears up a lot of questions that I had, so I hope it clears up a lot of the questions you had at home. And that'll do it for this edition of Healthline 3. Have a great day, everybody, and we'll see you right back here next time.